Hey, behind the microphone with Dr. David Klein, and today we're going to be talking about chronic bowel issues. Boy, there's people just double up in pain out there, and there's other people that don't know what's causing it, but it hurts.
Well, it's a funny sort of a thing, but that little tummy ache that kept you from going to school when you were a kid, it was real to you at the time. It should have been if it weren't. But in any event, there are lots and lots of folks out there that have chronic bowel issues. You know who you are. You're either suffering from constipation, diarrhea, or this nastiness sometimes known as Crohn's disease or ulcerative colitis. But more interestingly, those individuals that know that there's something wrong but cannot come up with a structural or physiological diagnosis. This is a real problem. 80% of your autonomic nervous system involves your gut. You have more bacteria in your gut, okay, than you can imagine. Okay, it's, you say, well, it's 3 pounds in your colon alone. Well, it's really more interesting than that. Okay, if you look at the DNA in your body, just the total load of DNA, only 2% of it's yours. The other 98% belong to the bacteria, and they're floating around in your gut. Now, what does this mean to you? It means that there are lots of opportunities to screw things up. There are lots of opportunities that you might or might not have to make things a lot worse from yourself, either from what you eat, what you drink, what you don't eat, what you don't drink, the medications that you take, and oddly enough, those other little things that you do that are like swallowing hand grenades with regards to the gut bacteria. So understand how this works. Irritable bowel syndrome may be more than one disease. Ulcerative colitis may certainly be more than one disease, more than one cause. Crohn's disease, nobody really knows what causes it. Is it bacterial? Is it viral? Is it autoimmune? Nobody really knows. And there's no singular treatment that works for everybody, which should suggest, okay, that it's more than one disease state. Now, what can you do to make yourself sick? And the joke here is that if you know what you can do to make yourself sick, you can know how to make yourself better. So if you're not pooping 3 times a day, you got a problem, okay? Because that's just what a mammal's supposed to do. After every time you eat, you're supposed to want to go defecate. Okay, that's the multiple doctor word. That's the one where we charge more for pooping. Okay, you eat, you poop, the way it's supposed to go. If you don't, then there's something wrong with you or something wrong with your gut. So what's the most common way that we mess things up? Oddly enough, it's not what you think. It's going to be not taking enough oil in your diet. By not taking enough oil in your diet, you slow down what's called transit time. That's the time that it takes to process the food from your incisors. Those are your front teeth to the last piece of your GI tract, which is known by all kinds of vulgar terms, but we call it teeth to tush time. Okay? Now, that time should be fairly short. It should be about 12 hours. But there are many people out there that it takes 30 hours or more for you to see proper safe passage from teeth to tush. Why is this? And the answer is very, very simple. It's not the stomach that causes the issue. It's not the small bowel, but it's the colon that really is the main bad actor here. The colon has one function, and one alone, and it's to take water out of your GI tract. It's there to keep you from dying of dehydration. If the colon didn't do its job, as is the case in cholera, okay, you develop cholera, you're pooping 20, 30 liters. That's quarts per day. You die of dehydration. How do you treat somebody with cholera? You give them water. You give them D5, okay, or D5 normal or whatever, the solute on hand, and you hydrate the heck out of them. And that's how you save them. It's not antibiotics that save them. It's actually the water. Okay, World Health Organization, we used to distribute these packets, were little more than sugar and salt. And what you do, you mixed it with the local water and you drank it, okay, to replace the fluids, and you could save somebody with cholera doing the same thing. Big time killer during wartime, and it's a big time killer in undeveloped countries. Well, how do we damage our gut? By not taking in enough oil. Oil prevents the absorption of water in the gut. So what happens is you take enough oil in your diet, you too can poop like Dr. Dave. And it works a little something like this. You have to overcome the body's ability to absorb it. So things like fish oil, that absorbs beautifully. Evening primrose oil, oh, marvelous. Borage oil, these are great sources of omega-3 fatty acids. But the body absorbs them so well that there's nothing left in the colon. So you have to do it a little bit differently for lower GI purposes. So I use a combination of CLA, that stands for conjugated linoleic acid, capital C, capital L, capital A. The dosage there varies, but it's usually around 2 grams of CLA twice a day. somewhere between 1,600 and 2,500 milligrams works. Okay, you do that breakfast and dinner. You take it with your food. At bedtime, a second oil that doesn't get absorbed, and it's called flaxseed oil. 2 grams of flaxseed. So that's 2 grams of CLA twice a day, 2 grams of flaxseed oil at bedtime, and it takes about 3 days to a week, and then all of a sudden things start to work their way through on a more regular basis. Does it take more than that? Frequently, yes, so you have to adjust the dosage up or down. Now, this is not the same thing as taking fish oil. You take fish oil as well. Okay, when do you take fish oil? In between and in betwixt the consumption of the CLA, because you don't want the CLA to block the absorption of the fish oil. So you take your fish oil at some other time, like bedtime, if you need to, but it can be done. It's fairly easily done, and it'll make you a whole lot healthier. What else can we do to make our gut unhealthy, and what can we do to fix it? Well, every time you've gotten sick and gone to the doctor's office and go, I think I need an antibiotic because my nose is running, and your doctor's thinking, oh my God, let's get this whiny person out of here, and they write you the antibiotic, you are both guilty. Okay, why? Because patients very frequently come in and want something. Okay, the docs want little more than just to get them the heck out of there, so you go by the path of least resistance. And instead of convincing the patient, okay, that they don't necessarily need an antibiotic, but what they really need is to take either a cathartic, take a rest, okay, or to take an antiviral, but they want their antibiotic. I want a Z-Pack. So what do? It's like swallowing a hand grenade to the bacteria in your gut. So one course of antibiotic, it may take you a year or more for the complex milieu of bacteria in your gut to be restored. And you're going to go, well, what if I take a probiotic? And I go, well, what if you wish upon a star? It works for Walt Disney. It is not going to work for you. Why? Because there are hundreds of different bacteria in the gut and viruses and yeasts and so on and so forth. But when you take a probiotic, you may only get 4 to 6 strains to replace the 100 that are in there, and they're all different. And if you didn't think that's interesting enough, for every 10 feet of gut, the colonic bacteria change. The nature, the names of these beasties change for every 10 feet of your gut. So there's no single pill that you can take, not one that will replenish the whole shooting match, let alone putting it in the right ratios. So the trick is to not take antibiotics unless you have something that looks like cellulitis, something that looks like pneumonia, or if you're kicking out green sputum. I mean, things where you know that you're really, really sick. Antibiotics are not to be used willy-nilly because it takes a long time and a lot of resources to fix the bacteria after you've damaged it. This data is very interesting. For every antibiotic regimen you have ever been on, it has increased your risk of dying, it's increased your risk of developing diabetes, and it shortens your tenure here on Earth. Not a good system. Now, that being said, what can you do to make yourself feel better? Well, the CLA, oddly enough, is very, very useful for irritable bowel, other inflammatory bowel diseases. But really what I want to talk to you about is something called colostrum. Colostrum is wickedly cool stuff with regards to irritable bowel, ulcerative disease, ulcerative colitis, and Crohn's disease. Colostrum, if taken in sufficient dosage, and if you're taking the right one, which has to contain something called lactoferrins, is extraordinarily beneficial with regards to chronic irritable bowel syndrome. Dosage there is upwards of 5 grams a day. This is not little dribs and drabs, and it's not the liquid garbage that you're going to get at the health food store. Okay, you want something that's in capsular form because it's unlikely that you're going to get listeria and die. Okay, getting listeria from your colostrum really is embarrassing. You end up on dialysis. It's just not a pretty way to finish out your day, let's say. So colostrum capsules, if taken properly, the dosage is 5 grams daily. In addition to the colostrum, okay, there's something called L-glutamine, which helps with the production of mucus within your gut. The dosage there, interestingly and conveniently, is also 5 grams a day. So there are things that you can do for irritable bowel disease, there are things you can do for ulcerative colitis, Crohn's disease, that don't necessarily involve taking methotrexate or things that may in fact cause leukemia. Oddly, it's safe, it's easy, inexpensive, and it can be done.
All right. If you want more information, stagesoflifevitamins.com will put you in touch with the nutraceuticals you need, stagesoflifevitamins.com. And if you want to know more information about Dr. Klein and the practice, suffernomore.com, suffernomore.com. You'll get all the information you need right there. Thank you, Doc. Thank you.